Hey, this is Jonathan Sweet with Merit Medical, and this is a brief overview of a CT scan. The CT scan is covering the thoracic and abdominal portion of the anatomy. It's with both oral and IV contrast, and you'll notice that the organs in the vascular system and the organs in the digestive system are lit up very brightly. It gives us a vivid picture of what's going on. The images are cross-sectional in the axial plane, and we'll start with the upper chest and scroll down all the way to the patient's pelvis. So let's rewind and take a look from the top what's going on here. Since we are starting in the chest, we see the most predominant thing is the lungs. We also see the heart here in the center. A couple other things worth noting is the spine. It lets us know that the patient is on their back, and the ascending aorta. As we scroll down, the liver starts coming into view. And as we scroll down even further, we see that the liver starts to replace the lung as the most predominant thing in the screen. We start to see over on the right hand side the spleen come into view. It's very bright, which is a good indication that it's a supravascular organ since we're under IV contrast. We begin to scroll down a little further, and a few other things come into view. And here on the left hand side we see the gallbladder. It's kind of surrounded by the liver and protected. And then over on the right hand side we see this little small object is the adrenal gland, and here up top is the stomach. Continuing to move down, we see the liver and the stomach diminish, and here in the center is the pancreas, and we see the kidneys starting to come into view. Another interesting thing we see happen as we move down is the descending aorta splits here into the iliac arteries, and we see the renal pelvis. That would be the funnel-like dilated part of the ureter in the kidney. That would be the target for some of our nephrostomy procedures. We scroll on down and the kidneys start to fade away, and we see the small intestines come into view with some air pockets and pockets of contrast lit up very brightly as it makes its way down from where the patient has consumed it. On the left hand side we see the large intestine, and as we scroll down we start to see some irregularity with some hair type fuzzy lines, and that's a pocket of abscess. And luckily we also see a resolve locking catheter coming in from the right hand side to drain that abscess. And as you can probably guess, that is the reason I was observing this particular case. Then we'll just scroll on down and we reach the end of the CT scan. Hopefully this will make you feel a little more comfortable as you start supporting some of the biopsy and drainage procedures that are performed in the CT lab. So go ahead and watch this thing as many times as you need to get up and running, and good luck.